own admission.
Thank you so much, Honourable Speaker. Well, I rise today to speak in support of the motion that's before us, because we need to ensure the safety of our vulnerable youth and adults who are at risk of harm to themselves or others. We need modernized, compassionate facilities with 24/7 psychiatric and medical support. And unfortunately, this government has failed to take adequate action to address this crisis. Well, they are answering the call of treatment and mental health supports with more addictive drugs. And the results are getting worse. There are so many within my constituency struggling with finding the mental health supports for their children, young adults, and relatives. The desperate cries from these relatives to try and secure mental health supports literally haunts me, because there are so many. The subject line from an email I received late Saturday night said, "Is anyone listening anymore?" The Premier has yet to take action on the Government of Canada's letter of requirements to support BC's decriminalization of hard drugs like crystal meth, crack cocaine, and fentanyl, which includes specific actions and commitments to expand treatment capacity, engage with key stakeholders and Indigenous partners, increase public education and communications, and develop monitoring and evaluation models. Illicit drug use in public spaces has exposed innocent children to harmful scenes, substances, and paraphernalia. Increased social disorder has impacted our communities and small businesses. Shockingly, someone dies from an overdose every few hours, averaging out to 6 lives taken every single day. And it's getting worse. This is unacceptable, and British Columbians have had enough. Their compassion fatigue is growing. It needs to end, and those suffering from addiction deserve the treatment, care, and respect from the government to get well and to one day thrive and reach their full potential. The BC United Caucus stands by our Better is Possible plan, which amongst many other results-focused initiatives includes compassionate involuntary treatment. We propose bringing forward legislation allowing the limited use of involuntary treatment to keep our most vulnerable youth and adults at risk of harm to themselves or others safe at modernized, compassionate facilities with 24/7 psychiatric and medical support, to give them a path to wholeness and healing, rather than the path that they are given today, which leads to homelessness and hopelessness. Better is possible, Honourable Speaker, which is why our plan also calls for a comprehensive range of supports for the most vulnerable British Columbians experiencing addiction and mental health troubles, such as affordable and accessible treatment, which would eliminate user fees at publicly funded addiction treatment beds and provide direct government funding for private beds through surge capacity agreements to ensure no one faces financial barriers to treatment. This is on top of complex mental health support, which calls for a tripling of the beds at the Redfish Healing Centre at Riverview and building additional regional centres using that successful model in the North, Thompson, Okanagan, Kootenays, and Vancouver Island to ensure that those requiring highly specialized mental health support can receive it close to home. Experts such as Dr. Julian Summers, a distinguished professor at SFU, and treatment and recovery experts such as Susan Hogarth from Westminster House support this plan. Compassionate, recovery-focused involuntary treatment used as a last resort for those who are most at risk of harming themselves or others should be considered. After more than 6 years of poor results for all British Columbians and an absolute downward spiral that is taking place, a change in approach is needed. By taking a comprehensive, collaborative approach, we can work towards creating a society where everyone has the opportunity to live healthy, fulfilling lives, free from the devastating impacts of addiction. We cannot afford to keep losing more lives to the addiction and toxic drug crisis. We must protect our loved ones, colleagues, and fellow British Columbians. Action is needed now. Thank you, Honourable Speaker.
Thank you.